Good afternoon. My name's Jill Ludford and I'm the Chief Executive of the Murrumbidgee Local Health District. The year in review was a year like no other. As our health service focused on public health issues, we also worked to ensure that we kept our links with communities and that we kept all of our health services moving forward. This afternoon I'm going to talk you through some of the achievements from the year 2020 to 2021. I'm going to start with some key highlights. Many of us during this period were in long periods of stay-at-home orders and were unable to travel and connect with families. That included myself. I was unable to undertake my usual road journeys out visiting our facilities and linking in with our staff, our communities and our councils. Face-to-face connection will never be replaced with virtual meetings, but we all got really great at doing virtual meetings and I can't wait to be back on the road and out and connecting with our communities. As a rural health service, connecting with our people is one of the singly most important things that we need to continue focusing on, involving our families, our communities and our patients and consumers in the development of care as we move forward. So some of the highlights. The first one I want to talk about is the New South Wales Government's signing of a local decision-making accord here in the Riverina Murray. It is very, very important that we work with RIMRA, the Riverina Murray Regional Alliance, on developing culturally informed care across all layers of government. We in health are absolutely committed to working with RIMRA and want to recognise the work that they have done in putting forward their priorities to move forward. Health and healing, strengthening families, housing, reducing incarceration and justice is very, very important for our Aboriginal communities. Then I want to talk about how we're elevating human experience. Does sound a little bit jargonistic, but over time, clinicians are very focused on delivering the right evidence-based clinical care. But what we recognise now is it's not just about the clinical care, it's about how you feel when you are in our facilities or when you're in our care and the experience that you have. How do we communicate with you? How do we link up all the messages between all the various clinical teams? That's what we call the human experience. But it's also about the experience for our staff, who, if they're happy, will give you a positive experience as well. As one of these initiatives, we have put into 2 of our emergency departments patient experience officers, and their job really is kindness and caring for you while you wait to be seen by your clinical teams, making sure that you have what you need, your phone is charged, and that you understand the waiting times, and that if you have any clinical needs that are urgent, that these are then communicated to the teams. We've had overwhelmingly positive feedback about how patient experience officers help people in their greatest times of need. We've also started collecting what we call patient-reported measures. Again, sounds very bureaucratic, but rather than just collecting timestamps and KPIs that are very much about numbers and metrics, we are now collecting outcomes for people that matter to them. Things such as how they are getting on after an operation, how they're getting back into their normal life, the length of time it takes for them to get back to work, and the effectiveness of their treatment. This is really important for clinicians to understand when talking about the holistic care of people. Also, getting in prevention and early intervention is an important part of the work we do. It's not just about treatment, it's about wellness. So one of the first year milestones for a very important program that we've undertaken is the early intervention family support. This program works with community leaders in identifying families who have got really complex needs. Getting in and working with those families, with the other service providers and linking them with the right referrals and support really gives them that holistic care that they need to give their children the best start to life. And moving on now to surgery. Last year, during the pandemic, we had to defer some of our surgery, our non-urgent planned elective surgery, to enable our clinical staff to be retrained, to be able to care for people should we need them in intensive care. During the last 12 months, we undertook all of our booked surgery and all of that makeup surgery. and on the 30th of June 2021, we had no patients overdue for planned elective surgery, and we undertook 13.3% additional surgery in that 12-month period. So huge thanks to all of our perioperative staff, our doctors, our nurses, and we did lots and lots of joint replacements in that time to make sure that people could get out and back into their normal lives. Living well your way, this is about chronic disease, but it's a whole new way of treating people with chronic disease. Instead of people having their GP care over here and then having to come in and out of hospital, it's about joining it up, getting in early and creating a pathway. It is a collaboration with the primary health network, not just the local health district, and joining in the work that our physios out in the private sector, that our GPs are doing. But best of all, the whole pathway has been informed by our consumers, and it was not what we expected. But if we have that care pathway and we fill in the gaps for people, that will help people to stay out of hospital and to have a much healthier, happier life. I want to talk also about some other holistic care we did, some care we did with the Brungle community near Tumut. It was a multi-agency health expo, a beautiful day where we all came together at the Brungle Health Centre. And our Aboriginal communities really wanted us to bring all the agencies together to show how we can deliver wellness, holistic care, and all of the different types of services that are available right across our region. It was all about also ensuring that the care we provide is culturally informed and culturally safe for our Aboriginal people. And we are absolutely committed to working with Aboriginal communities in bringing those multi-agencies together to help inform the care that we deliver. And as our board chair has already mentioned, work occurred in the year in developing a new strategic plan, Exceptional Rural Healthcare. It builds on the last 3 years' strategic directions, which are all about our people, excellence in clinical services, and focusing on wellness. And the plan sets us up for the next 5 years for a very bright future. Now, as Chief Executive, I now need to move on and talk about some of the achievements that we have made in terms of activity. So I'm just going to give you a few numbers here now to help highlight the enormity of the area that we cover and the numbers of episodes of care that we deliver. So let's start with our emergency departments. Over 140,000 people presented for emergency care right across the Murrumbidgee region. And we have those emergency care centres open 24 hours a day, 7 days a week, even Christmas Day and Easter. We also deliver care outside of the hospital setting. 973,800 episodes of care were undertaken outside of the hospital setting. That's our teams like community nurses, our community mental health teams, allied health clinicians, our clinics. It's very, very important care. Care is not just about hospitals and beds. But speaking of those, we did nearly 20,000 surgeries last year, as I said, 13% more than the previous year. And in our hospitals, 2,175 babies were born and started their life. At the other end of the spectrum, we care for nearly 350 aged care residents as a major aged care provider across our region. Chronic disease is an enormous issue facing rural health services, and we undertook 13,798 episodes of renal dialysis, and renal dialysis is one of our fastest growing clinical services, growing at a rate at the moment of about 30% on last year. All of this work cost the taxpayer $734 million, and of that we spent $33 million on COVID-related care as well. I'm going to move on now to talk about some of our innovations, and that we have some projects underway that are actually first in state. And I want to start with training doctors. We know there's a shortage of GPs right across our region, and rather than sitting back and watching as fewer and fewer doctors started to undertake GP training, let alone in the rural sector, we decided to do something about it. Rural generalists are different to GPs. They're GPs who have got advanced skills that skill them up to be able to work in a small rural hospital. Things like anaesthetics, delivering babies, emergency department, mental health, palliative care, all important skills to be able to work in the rural sector. The pathway as it existed was piecemeal, and it didn't give trainees equal status with the other specialty training programs. So we've undertaken to employ GP trainees and give them a positive experience, give them all the benefits of being employed for that 4-year period while they go through their training program, and offer them really great mentoring, supervision and quality support and assistance. We have 5 trainees who have joined us this year, and we're very, very proud of the work that they're doing. In another program, a first, Arts in Health. Arts in Health came along with Health Infrastructure and New South Wales Art Gallery. It's something for our aged care residents, and as we were building some of our new MPSs, in particular Murrumburra Harden, Culcan and Tumbarumba, we saw there was a need to enhance the holistic care of our residents. We are building their homes, and what do we have in our homes? We have social and culture. Art provides just that, and Art Galleries New South Wales have provided some absolutely beautiful artwork and relevant activities around the art that forms that connection point for residents. It's something to tell stories about. It's something that evokes emotion with people, to talk with their families. And best of all, our staff are also involved, and it's also given them a greater connection with our residents. During COVID-19, it was absolutely invaluable. And the Murrumbidgee Stroke Service. The Stroke Service is a multi-award winning service, and it is led by Professor Martin Jude, Catherine Moore, and a whole team of allied health and nursing professionals. They were awarded the prestigious World Stroke Organisation's Angel Gold Status Award in November of 2020. It was recognised for best care, meaning all the highest standards in stroke treatment. It is the first in Australia to receive such a prestigious award, and we are extraordinarily proud of the work that they're doing, but best, the outcomes, life and death outcomes for people in our region. And you'll see a picture there of Professor Jude. Other innovations have occurred also. I want to talk about a few of those that are both ICT related, which is digital technology, but also some of the innovations that we're doing in how we care for people in our wards. They say necessity is the mother of invention, and of course, because we're a rural health service, sometimes we have to be more inventive. We have a very large geographical area that we need to cover, and we've all become absolutely expert, as I've already said, at using Zoom and Teams and all those other digital platforms. But during this time, we realised that we needed to enhance the infrastructure to make digital technology easier for our people in community, but also for our staff. It needed to be foolproof, it needed to be simple. So the telehealth capability was enhanced enormously over this period, which was perfect with the COVID pandemic, where we had to move to delivering virtual care as staff who were in lockdown were unable to travel as part of their work. My Virtual Care is a brand new platform. It has a virtual waiting room. It's on our Murrumbidgee website, and it's simple to use. Clinicians were able to book appointments, to see their consumers, their patients, and click into the waiting room and bring their patients in and still see each other and connect in that way that is so important. Telephones are not virtual care. You really need to be able to see somebody, connect with them and build that trust and rapport. At the same time, the virtual care in our emergency departments also needed to be upgraded. The new cameras that we've put in there that provide ultra clear pictures, the best thing about them is they don't go down and they're foolproof for our staff. Flick a switch, it's on, and you're connected with who you needed to. And all that work is recorded and goes into the patient record. Very, very important infrastructure for a rural local health district. A couple of clinical innovations. The first for Riverina area, is in surgery. So day-only hip surgery. Day-only hip surgery might not be for everybody, but for people who don't have other health related illnesses, having your surgery and getting back to work, to sport, to your usual activities is really important. Day-only hip surgery sees a spinal anaesthetic, up out of bed and walking within 4 hours of surgery, and then home on a specialised program supported by our physiotherapists and occupational therapists. All of our consumers who have been involved in that have absolutely given it the thumbs up. And finally, our safe wards. This is an innovation that's being undertaken by our mental health services, our admitted mental health patients. It's a new initiative to support consumers in the acute mental health setting. And it's all about involving peer workers with a lived experience in mental health, and our staff draw on their own experiences to educate the staff and ultimately improve the interaction with consumers and improve interaction and outcomes for our mental health patients. Part of the program is about reducing the stigma around mental health by fostering open discussion in a safe environment. Participants share their own experience and health journeys, leading to better understanding of people who are going through a similar experience. And now on to some of our buildings and infrastructure. We have been very fortunate over the last few years to have the opportunity to expand and build some of our new hospitals. I want to talk about the 4 that we have focused on over the last 12 months, and not to forget that we have some other rural minor works that have been undergoing planning, and those are in Deniliquin and Leeton, and we look forward to that work being undertaken now in this financial year and seeing those enhanced emergency departments for Deniliquin and Leeton. But let's start with the Tumut Health Service, which is the first redevelopment of a district hospital in our region. It has been an extraordinarily rewarding project, engagement with the community, engagement with the Aboriginal consumers in the region, and our staff absolutely embracing an opportunity to do things differently. District hospitals are very, very important. All of our district hospitals provide acute care and reduce the need for some of our patients to have to travel all the way to the bigger base hospitals. So building Tumut, which has a renal unit, enhanced surgery, birthing services, and enhanced technology and equipment in medical imaging will be very important to reduce the need for patients to travel to Wagga Wagga. On the other end of the spectrum and the other side of our district, the Hay Health Service has wonderful aged care services, but really needed some modernisation, and some of the flows within the hospital too were not quite right. So we were able to use some of the funding from the MPS redevelopment program to do some enhancements to Hay Hospital, which have just been completed and are very exciting. New aged care rooms that give more areas for people to undertake activities, and really improving the flow in the emergency department. And really importantly for Hay, one of our more remote health services, brand new staff accommodation. People who work in Hay may live out on properties a long way away, or we might need to bring in students or agency staff. So enhancing our accommodation for our rural hospitals is and continues to be a very, very important focus for Murrumbidgee Local Health District. Griffith Bay Hospital redevelopment is moving along, and the work that we saw in the 12 months was about planning for the non-clinical services block, which then enables the acute service block to start building, which is in 2022. That will enable the site to clear all those old buildings at the back of the hospital, ready for the new hospital build. We've also planned and now opened the temporary paediatric wing, and I do want to thank all of the staff who have been heavily involved at the same time with the detailed planning of the acute services block, which is looking absolutely beautiful. We look forward to that construction in 2022. And finally, the Wagga Wagga Stage 3. Whilst we still have the car park, which is under construction, this was the final part of the actual hospital redevelopment. And the Health Services Hub is home now to a range of ambulatory services as well as inpatient admitted services. It's home to a huge new renal dialysis unit that's got educational and home dialysis teaching facilities. It's home to our rehabilitation wards, our specialist mental health aged care wards, and also to aged care services. Best of all, it brought 60 services together in one building, and the ambulatory care clinics and those consultation areas are beautiful. And it was designed specially understanding that people from right across our Murrumbidgee region may be there for some days, and we needed to provide families and visitors with a place to rest, a place to eat, while they are looking after their loved ones in hospital. It's a beautiful building, and you can see a picture on the screen now. Just moving on to our people. Whilst I'm going to talk about two people who have won awards this year, I do want to also recognise all of our staff, not just our doctors and nurses and allied health clinicians, but all of the support staff, the asset management teams, the administration teams, the finance teams, the people and culture teams. Thank you for all you have done. You continue to exceed expectations in caring for people in our communities. But there are two people I want to point out now. The first, Kieran Preston, 2020 New South Wales Nurse of the Year. And I was there when that award was announced, and my whole body was tingling. Kieran absolutely personifies nursing in Murrumbidgee. He is known for his kindness and his compassion as he cares for people in the mental health setting. And his trait of empathy for others is hugely appreciated. And congratulations to Kieran, who is an amazing nurse. And another person I wanted to point out was Jenna Weymouth, a proud Wiradjuri woman who we are also proud of. And she was the 2021 Aboriginal and Torres Strait Islander Student of the Year for TAFE, Riverina TAFE, New South Wales. She completed her Certificate for an Aboriginal and Torres Strait Islander primary healthcare practice. Her passion lies in providing Aboriginal health services, and this work that she has done enables her to progress from an Aboriginal health worker to becoming an Aboriginal health practitioner, not only supporting her patients socially and emotionally, but now being able to care for them clinically as well. Congratulations, Jenna. We are very, very proud of your achievements. And then we can't finish off by talking about the year without talking about the pandemic response. And as we reflect, we can't do so without acknowledging the enormous changes that our healthcare clinicians have made during this time. We are still working under emergency response procedures. 20 months we have been going through this, and our people have gone out. Nearly every person you meet who works in the health service has somehow or other had their job changed or their role changed, or have gone above and beyond over the last 20 months. As I've already thanked them, I want to thank you now, our communities, for the recognition of our healthcare workers during this time. They have stepped up. They've stepped up to keep you safe. Just a quick look at some of the work that they have been doing. COVID testing, not only in our static clinics, but in the COVID testing vans that have gone out to even the most remote villages across our region when the need was there. Up until June 2021, we had undertaken nearly 124,000 COVID swabs and tests, the majority of which were able to be locally processed here in our New South Wales Pathology Laboratory at Wagga Wagga. During this time of long periods of lockdown, long periods of time where people were not able to connect with their family, border closures, border restrictions, no overseas travel, our workforce was enormously impacted. We have relied for many years on staff coming in to work in our region and going out again, and this was not able to occur. And it has placed enormous pressure on the staff who will remain to be able to work up and fill some of those vacancies. Our staff were trained in intensive care to be able to care for our COVID patients. Our staff were retrained to care for patients in isolation at home with COVID-19. Also, we have administered during that period 17,000 doses of the vaccination into the arms of our staff, first responders, elderly aged care, and then the greater population. During this time, we spent $33 million on our COVID response, including extra efforts to decrease our surgery waiting lists, assessment clinics, and of course the additional PPE that was required to keep our communities and staff safe. And now, with an impressive population vaccination rate of first dose at 97.3% for those aged over 16 and over 90% people fully vaccinated, we are now working in a different way. We're working around living with COVID, and as we still continue to see outbreaks now, the community has a layer of protection that was not there before. So now, in closing, the past year has been an incredible journey and a learning experience for absolutely all of us. I want to extend my thanks and appreciation to the Murrumbidgee Local Health District Board for their work and guidance over the last 12 months. It's been a time of rapid change with our response to COVID-19, even in the last few months, as we've continued to experience and respond to outbreaks across our region. I would also like to acknowledge the work and dedication of all of our volunteers, our hospital auxiliary workers, our local advisory committee members, the volunteers who help with wayfinding, the volunteers who come into our multi-purpose services to assist with our aged care activities, and many more. Thank you so much for the work you do that also helps to care for our patients. Thank you. Reflecting on the year that was has made me incredibly proud of the exceptional work still being undertaken by our health service for you. We've worked together in challenging times and heightened anxiety. Exceptional care has continued to be provided to our communities through our workforce doing what they do best. And importantly, we've kept each other safe. As Chief Executive, I can't be more honoured to represent our entire workforce and to represent these achievements that puts the spotlight on our continued dedication to providing safe care for you across our region. Thank you.